So my task is to talk about guardians of infection control, the nurse's vital role. So you listen to the quality care by the speeches of quality care by the president and also the director quality, and also about the antimicrobial resistance and how we should overcome the challenge. Now, what is your role? Now, what is infection control? It has three modes. One is prevention, the second is surveillance, and the third is outbreak management. And this is the infection control network, if you can see. We do daily ward rounds by the infection control team. And the on-site advice is being given for MRSA screening, decolonization, and on aseptic techniques. I'll go through that. And waste management, cleaning, accidental exposure injuries, surveillance of hepatitis, the bloodborne viruses, and also surveillance of influenza-like illnesses, and notification of infectious diseases, and also the surveillance of nosocomial infections and multi-drug resistant pathogens, advice on vaccination, and offer vaccines where available. So all these things are being done within the infection control network. Moving on to antimicrobial resistance, what are the things predisposing to antimicrobial resistance? You can see the, don't tell me this. So this one, poor infection control in hospitals and clinics, right? And then patients not taking antibiotics as prescribed, and poor hygiene and sanitation practices. Don't you think that you can intervene in all three places, right? So these are major factors predisposing to antimicrobial resistance, and definitely you can have you will have a role to prevent those factors. So what is important in routine nursing practice? One is hand hygiene in standard personal protective equipment. And aseptic procedures should be adhered all the time in blood drawing, catheterization, wound management, cannula and line insertion, and also handling them, and trachecare. Then disinfection of used items like masks and ambu bags, right? The other things. Then MRSA screening, decolonization if necessary, daily body bath, and caring of critically ill and for bedridden and ICU patients. I think you all know that. An antimicrobial prescription chart, as Dr. Akmal Fonseca mentioned. And surveillance of hospital-acquired infections and hand hygiene audits are important. And then, most important is the education on personal hygiene, hand hygiene for patients as well as for the staff. This is the chart. This is the national chart. And what is hand hygiene audit? We go through the 5 moments of hand hygiene: before patient contact, before aseptic procedures, after patient contact, after exposure to blood products and body fluids, and after touching the patient surroundings. Those are the things we are auditing, whether the nursing staff, the doctor staff, nursing staff, and also the other staff is doing. So this is from 2015 to 2023, the audits we did in teaching hospital Karapite formerly, and now it's called National Hospital Goal. So you can see how they have improved, how they have declined so time to time. So it's actually very, very good to see the ICUs are improving. How the infection control nurse can help prevent MDR infection. On-site advice, as I told you, and overall surveillance. She's a team member in policy development of hand hygiene, aseptic procedures, decolonization, and all that procedures. And also review, update, and monitoring compliance of hand hygiene and aseptic techniques and antibiotic chart as well. Help the outbreak investigations and control. When there's an outbreak, definitely there's the role for all the nursing staff and the infection control nursing officers and education. So this is how we conducted from 2020 to 2024 the MDRO surveillance, multi-drug resistant surveillance. You can see the ESBL prevalence, MRSA, multi-drug resistant Acinetobacter, carbapenem resistant bacteria and coliforms, and also vancomycin resistant enterococcus. And following up is also important. In the follow-up, you need to think of the barrier nursing, especially when there are patients with MDRO infections staying for a long time. They can spread they can cause cross infections to the other patients, and also cohorting. If you have several patients with multi-drug resistant, you can have them together and have barrier nursing and have all that techniques doing together. So there will be minimum cross contamination to the other patients. And decolonization. When you are doing decolonization, the most important thing is once the decolonization regime is over, you have to rescreen and see whether you have been successful. Refractory cases, you have to refer for the microbiology opinion and education. For the patients, and also you need to educate them to prevent cross-infections to the household members as well. So what is MRSA decolonization? You can do that for the infected patients as for the patients and for the patients awaiting major operative procedures as well. That is a 5-day regime. We can do nasal and nasal decolonization and also the body bath. When you are swabbing for the screening, don't insert the swab deep inside the nasal cavity, like in you are taking the influenza swab, right? Just swabbing into the nasal cavity is enough. So procedure is nasal. You do 2% mupirocin twice daily or 3 times daily, and body bath with 4% chlorhexidine for 5 days consecutively, and hair wash with 4% chlorhexidine every other day for 5 days. So like I said, after decolonization, stay for 2 days and do rescreening, and refractory cases, that means the resistant cases, you have to refer. So what is infection control nurses duty list? This is the National Hospital goal. This should be 2016 duty list, right? Who is the infection control nursing officer? The member of the main infection control team or the licensed nurse from the respective wards, most powerful nurse in the hospital, right? Am I correct? Do you have that authority in your hospital? So how can you have that authority? By the empowerment comes with the specific duty list, and you should be adhere to the duty list, and that duty list should be followed up by the nursing officer, and also the other staff should be aware of that duty list, that you are an authorized person. So one thing is implementation of the infection control recommendations given to the ward, unit and hospital. Then you have to work in cooperation with the infection control and prevention main team and help them to gather information and data. And you should attend all infection control monthly meetings, and you should train the ward staff, not only the nurses, but also the doctors and the other employees as well, on the procedures, policies and guidelines on the infection control. And assist the nursing in charge to maintain the internal cleaning chart. What is internal cleaning chart? Do you have the internal cleaning chart in your hospital? So this is what we are maintaining in National Hospital goal. Every day you should maintain this chart, every day. So just tick off what has been done, and then you will know what has not been done. So then you can address that. Environmental cleaning is very much important in infection control, and also preventing cross contamination of the other patients with multi-drug resistant infections. and update the data on healthcare associated infections. And also notification process is very important. You have to assist and help the doctors in the process and assess the mortality rates of notifiable diseases and gather information on the infections among the staff. Nosocomial infections among the staff. When there's a varicella outbreak, when there's a measles outbreak, when there's an influenza outbreak, you have to address the, gather data, and with the help of the microbiologist and the infection control team, you have to help preventing the outbreak. And guidelines and circulars should be maintained, and you have to make your staff aware of the existence of those circulars and guidelines. And occupational exposure injuries, cut injuries, splash injuries, right? Those things should be, you need to have a registry on exposure injuries in your ward, and hepatitis B vaccination and antibody status should be known for the staff. And then you have to be aware of the global epidemics as well as the local epidemics, and you need to take the necessary precautions. And then supervise and guide the waste management, very important, and spill management. Whose responsibility is the spill management actually? Is it the responsibility of the junior staff, or the nursing officer, or the doctor? It is the responsibility of everybody in the clinical staff, right? Not the cleaning staff. Don't hand over the spill management to the cleaning staff, please. That is the responsibility of the clinical staff. The member of the clinical staff who sees the spill first should attend the spill. That doesn't mean that you have to be like doing all the things yourself, right? But you have to attend it. You just don't ignore. You have to attend, you have to gather the team, and you have to manage the spill. You have to you have to initiate the teamwork in the spill management. Right. This is the exposure injuries reporting chart of our hospital, and I'm sure that you may be having a similar one. And this is exposure injuries among different healthcare workers, right? Doctors, nurses, nursing students, and healthcare assistants and others, how they have sustained, how they have got this cut injuries, splash injuries, right, throughout the years. And one main thing is healthcare assistants. They don't handle sharps, right? It is our fault if they are having the sharp injuries. So our target should be to reduce the happening of this sharp injuries or the exposure injuries to the healthcare assistants as much as possible. That shows your quality of care. Right, blood spill management is done with 1% freshly prepared hypochlorite. So you have to place wadding or tissues or paper, whatever, to contain the spill and to prevent it further spreading. And after 5 minutes, then pour your freshly prepared hypochlorite and clean it off. After cleaning the spill cleaning the spill by the clinical staff with hypochlorite, then you can hand over the final step of mopping to the cleaning staff, but not before that. This is the protocol. So as I said, for each and every procedure, you need to have a written protocol so nobody can question, right? So the protocol is there, your local protocol, or guided by the infection control manual, the national manual. Then comes the second part of the infection control, that is surveillance. You can have anything as your surveillance. Surveillance help to identify early outbreaks and the source of outbreaks and help in preventing the misuse of antibiotics as well. So you can have your nosocomial infections, surgical site infection rate, bloodstream infection rate, catheter-related UTI rate, hospital-acquired pneumonia and ventilator-associated pneumonia rates, or line or device infection rates in your wards or respective units. And the rate of multi-drug resistant organisms monthly, and also then you can analyze annual rates as well. And then you can plot all the data to see the trend over the years. Then the exposure injuries, notifiable diseases, then refer to the list of notifiable diseases, and any emerging infections like melioidosis. Antibiotic usage should be monitored as well. And antibiotic chart or EWS chart usage can be audited. Then the outbreak management. It can be a nosocomial outbreak, it can be a community outbreak, it can be a global outbreak like epidemic. So whatever, it should be investigated. And if there's a local outbreak, then you should investigate to the source, and if possible, source should be identified and source control should be there. And then you can prepare the final report with all that precautions you have taken to contain the outbreak. Then the most important thing is the collaborative work. The nursing officer can't work alone. She has to work with the others. Not only the doctors, but with the paramedics, with the junior staff, with the cleaning staff, with the clerical staff, with the administrators, all that people, with the security, right? With all the people, you have to work in collaboration. Then only your teamwork will be effective. So your isolation ward should be addressed, and then working together with the medical education unit and the hospital administration, as I said. Work with the cleaning staff, employers, and laundry and food, the kitchen. Then help the involvement in the hospital design, right? When there's a newly built theater, you have to go and visit the theater as an infection control nursing officer, and then see whether the design, the layout, and all the things are according to the standards. If there's a mishap, then you have to address, then you have to point out that then these things are wrong. Then only the contractors and the designers can correct those errors. Then after finishing, we have to do the commissioning. Commissioning can be done with in collaboration with the microbiology team by settle plate methods, right? It's a rough method, but it's good enough to to monitor the air quality, the air contamination. We calculate the colony forming units per cubic meters of air. So that shows the air quality of the theater. Then you can prepare the final report. Then we can help and collaborate with the infection control teams of satellite hospitals. If your hospital is a major hospital, if your hospital is giving the care and the supervision to the other small peripheral hospitals, then you have to work in collaboration. So with all these measures, the ultimate target would be better service in infection control and prevention. So what is good practice? Written protocols for procedures. The hand hygiene facilities should be there. If there's a lacking, then you have to address those hand hygiene facilities. You have to work in collaboration with the administration to get down all the necessary items like alcohol hand rub, soap and water, and other reagents. Then proper sterilization and disinfection procedures should be adhered, and you have to supervise, and you have to see whether these are in place. Spill management, cleaning, good housekeeping, and maintain the pleasant environment. Then only you will be happy and your patients will be happy. Thank you very much.